In 1973, Aruna Shanbag, a 25-year-old nurse at Mumbai's KEM hospital, was sexually assaulted in the hospital's basement. The brutal attack left her in a vegetative state for 41 years until her death. 51 years later, in August 2024, a 31-year-old doctor at Kolkata's RG Kar Medical College was raped and murdered. This recent tragedy not only highlights the persistent issue of women's safety in our country, but also underscores the inhumane and unsafe environment in which our doctors work. The case demonstrates that 51 years after the Aruna Shanbag assault case, our hospitals remain unsafe for healthcare professionals. The incident at RG Kar Medical College has sparked widespread protest across the country. The authorities sprung into action after the case. On Monday, the Union Health Ministry assured a 25% increase in security personnel at all central government hospitals, along with an increase in CCTV cameras. The Maharashtra Police conducted a security audit of all medical colleges in the state and recommended an increase in security guard deployment and CCTV camera installation. Similarly, the West Bengal Health Department has instructed medical colleges in the state to install more CCTV cameras and increase the number of security personnel, particularly female security guards on campus. However, protesting doctors believe these measures are still insufficient. To ensure a safe working environment for doctors, the Indian Medical Association, various groups of resident doctors and other healthcare workers groups are demanding a central Healthcare Workers Protection Act. At present, we have no central act aimed at providing protection to our healthcare workers. Some states have laws at their level, but nothing exists at the national level with a uniform set of guidelines. In 2020, during the COVID-19 pandemic under the Epidemic Disease Amendment Ordinance 2020, attacks on healthcare workers serving during an epidemic were made a non-bailable cognizable offence. However, this is applicable only during an epidemic. In 2019, the government showed interest in introducing a Central Healthcare Workers Protection Act. The draft for the Healthcare Services Personnel and Clinical Establishments Prohibition of Violence and Damage to Property Bill 2019 was prepared. The draft was also circulated for consultations, but it didn't lead to anything. Last year, while responding to a query seeking reasons for not proceeding with the draft, the then Health Minister Mansukh Mandaviya mentioned that the government decided not to introduce a separate act for prohibiting violence against doctors and other healthcare professionals. On Monday, MP Shashi Tharoor recalled that last year he passed a private member's bill seeking protection for healthcare workers against acts of violence. While speaking to the media on Monday, Tharoor said that he was informed by the then Health Minister that the government cannot introduce a central act for healthcare workers, as doing so for one set of professionals would set a precedent for other professionals. So what protection do our healthcare workers have against acts of violence while on duty? As of 2020, 19 states had laws providing protection to healthcare workers, with Kerala and Karnataka having the most stringent acts. But the rest of the states and union territories still don't have a specific law or act for protecting healthcare workers against acts of violence. Different laws in different states lead to a lack of uniform guidelines. Additionally, at present, data regarding acts of violence against healthcare professionals is not maintained at the central level. Though the government claims there are provisions under the Bharatiya Nyaya Sahita to provide protection to healthcare workers, experts believe this is not enough. Hence, the demand for a Central Healthcare Workers Protection Act.
Well, thanks so much for tuning in to CNBC TV18. Make sure you follow us and stay updated on all our social media platforms.